I'm Kurt Kubiak, founder and CEO of NOVO Health, a group that was designed to deliver healthcare in a way that's more convenient for physicians and for patients. The problem that we're trying to solve in healthcare gets to accessibility and affordability. And the circumstances that we have today to manage are such that our premiums and coinsurance are going up every year for most patients and their families. So it used to cost about $9,000 to insure a family of 4. That's gone up to somewhere in the neighborhood of $26,000, right? If this was any other industry, if this were, the price of gasoline, or if this were the price of a gallon of milk, you would have people completely outraged. There'd be no question about it, because those costs come directly to us as consumers and take money out of our pocketbooks. But because healthcare has got this third-party payer issue where we don't pay the entire bill, there's no transparency, so I really don't know what the total cost is unless I add up all my bills after the fact. We tend to accept this as normal. We accept this as a standard way of doing business. And NOVO Health is here to say that that is 100% not true, right? That it's got to be different, that we must do something differently if we're going to try to change the trajectory of cost of health insurance and healthcare delivery, for my kids, for the kids of this country. And I, for one, can't stand by knowing what I know now about what's possible in terms of controlling cost and improving access and producing better quality results. I can't stand by and accept the status quo knowing that we can do better. The essence of what we're doing is changing the cost trajectory dramatically. And so we're dramatically bringing the cost of healthcare down. So the procedures that we perform, somewhere in the neighborhood of 10, 20, even 30%. I'd say even within the state, we're 50% less on some procedures than what you would pay if you went to another institution. So the cost savings are significant. The way that we deliver the model are in facilities that are cost effective with low administrative costs. And so as a result, we can afford to compensate physicians fairly while bringing the overall cost of those procedures down. So very different than the standard health insurance model where you go to a physician and facility, you don't know what the cost is going to be in advance. The bills are showing up somewhere, a few weeks after your procedure, but could last as many as 5, 6, 7, even 8 weeks post-operatively or post-procedure, and you still don't know what the costs are. Very confusing, causes anxiety to patients. Your healing process is just slower because you're emotionally not in a state of stability. And so there's all of these things that we can do differently to put patients in a better position to recover. It's really a neat thing to see, very smart people, very energetic, well-intentioned people coming together to solve this healthcare problem together, because it does take a different perspective from a physician's perspective to say, I'll take some risk and bundled price something in advance. I'm going to set a price point out there and let you know that I won't exceed that price point. And it does take some risk from an employer's standpoint to say, I'm going to try something very different that's not been done before, but I think the risk is worth the reward. And then for those patients, the employees of those employers, to equally say, if I don't do something different, then things aren't going to change. So they've got to take the time to become informed, to become educated, and consciously make a decision to become involved in their healthcare. That's very different. But the methodologies around NOVO Health allow all of those things to take place, all of those activities to take place on the platform that we've designed. And so for those reasons, we think it's the most cost-effective, efficient way of delivering healthcare in the country.